Hey, Dr. Matthew Denner here. We're going to talk about hip impingement syndrome. So it's also known as femoral acetabular impingement syndrome, and let's break that down. So femoral being the femur, our leg bone, acetabulum being our hip bone or pelvis, and the femoral acetabular joint is what makes up our hip joint. So hip impingement can be characterized as bony overgrowth on either the femur or the acetabulum. So if the bony overgrowth is on the femur, it's called a cam lesion. If the bony overgrowth is on the acetabulum, it's called a pincer lesion. But in most cases, it happens that there's a little bit of bony overgrowth on both of those structures. So we can get bony overgrowth from faulty biomechanics. So if we're not activating the muscles in the right way around the joint, there's a lack of stability, and we rely on passive structures. So passive structures, in this case, being our bone. So we move around, those bones knock into each other a little bit with every single movement, and our body thinks we're doing a great job of laying down new bone as kind of a protective mechanism. So our body doesn't like that our bones are hitting into each other, causes a little bit of pain. It lays down new bone on those structures in hopes of protecting it, but in the long run, it actually does some damage. It decreases range of motion, increases pain levels. So that's kind of the mechanism behind hip impingement syndrome. So some great treatment options out there. We create a little bit of space for that joint to move around, so some distraction or mobilization techniques. And then we use DNS, corrective exercises, to help recruit the right muscle activation around that joint, so we don't have to rely on the passive structures for stability. We can rely more on functional stability.